Welcome to our virtual event, and I'm so excited about tonight. It is going to be full and impactful and full of information. Hey, everybody, I'm Cheryl Jackson from the Midday Show, and I've got some special guests with me tonight. We're going to be talking about COVID-19 and reopening the Black community. We have a whole different perspective when it comes to COVID-19, so I'm glad that we have some major people on board who can help us break down the scenario, dispel a number of myths, and prayerfully answer your questions tonight. I love it because tonight we're going to be talking specifically about the Black and Brown community and with regards to COVID-19. And it's all being sponsored by Johns Hopkins Medical Center. So thank you so much for them being sponsors tonight and having some amazing guests on our panel. So for our first guest, we have Dr. Sherita Hill-Golden. She's the Vice President and Chief Diversity Office of Johns Hopkins Medicine. How are you?
I am great and happy to be here. Thanks for having me.
Listen, we're excited. We're the only girls on the panel, so we're going
to... We are. We're going to hold our own, though.
We're going to handle it tonight. Also, I had the opportunity to talk to him on last week, and very informative. Dr. Gallatsatos, Dr. G, I'm going to refer to you for the remainder of the night, but I did want to make sure I said his name correctly. Co-founder of Medicine for the Greater Good, Johns Hopkins Medicine. So informative, the interview we had earlier this week. So welcome to the virtual event tonight.
It's good to be here. It's an honor to be here. And Cheryl, it's good to actually see you. I got to hear you last week. So this is great.
Awesome. We also have on our panel my brother and my friend. I haven't seen him all year, so it's good to see him on this panel with us tonight. Really excited about all the opportunities that you have, all the stellar noms, bruh. You done joined the ranks of radio announcer and all of that great stuff. I am so excited to have you tonight. You know I love you to pieces. I'm talking about Anthony Brown, everybody. Welcome, bruh. We on mute. Go ahead.
Oh, you got me? I said, I'm so good to be here with you. Of course, I haven't seen you all year, so it's good to see you, at least virtually, and good evening to the other panelists, two of whom I know and two of whom I'm just meeting. Just honored to be in the room.
Awesome. It's going to be a great discussion tonight. It's always a good discussion when me and my brother get together. Pastor Keith Battle, so informative, so funny. I think he's going to give us a great perspective tonight with regards to the faith community and COVID-19. He's the founder and senior pastor of Zion Church in Landover. And so welcome, Pastor Battle.
Hey, Cheryl, thanks for having me.
Awesome. I'm glad you're here. And of course, we have as well with us, Dr. Howard John Wesley. I told him when I first got on, we have to say your whole name, right? Dr. Howard John Wesley. He's the senior pastor of Alfred Street Baptist Church in Alexandria, Virginia, very active with regards to informing the community about COVID-19. So I'm excited to have you tonight as well, Pastor Wesley.
Glad to be on with everybody else. Let's see if we can figure some stuff out. And I'm really glad to be on Pastor Battle so I can steal some of his ideas, take it back to Alpha Street and act like I came up with them.
Come on, man. Get out of here. Vice versa.
We're also waiting on Dr. Henry Davis III of the First Baptist Church of Highland Park, and so we'll bring him on when he comes in. But we have a lot to unfold. So let me say to our audience, thank you so much for joining us on our YouTube page, our Facebook pages, and our websites tonight. I want you to do me a favor. If you're on Facebook, share it on your page. And we really want to answer your questions. So don't let us just be here bantering. It is great that you get to hear, the information and all of the knowledge that we have with our panelists tonight, but we certainly want to hear from you. We certainly want to hear what you have to say tonight as well, so we can address your questions. There are a number of things that we want to jump in and start talking about. First, talking about the current state of the Black community. Just a few statistics. Black and brown people are being hospitalized and dying far more often with COVID-19 due to a history of structural racism, such as housing, employment, education, criminal justice, and in the healthcare system that's led to health inequalities or inequities. One of the things that really stuck out to me is that the world is starting to open back up. And at alarming rates, we're still getting COVID-19. Like we're, you know, even though the numbers have decreased about the number of hospitalizations, that's not the truth in our community. So I really want to start off, and either one of you can start off by answering these questions, Dr. G or Dr. Golden, you know, why that is. Like, why are we still getting COVID-19 at alarming rates? We'll start with that loaded question, and then we'll go from there.
Well, one of the things that I was going to actually do, and Dr. Golden, we can do this together. Let me just catch us up to where we're at, because this is night and day. You know, I actually was on service this week last year in 2020, and it was the second hardest week I've ever worked. The first hardest week happened in December 2020. We were not doing well, not as a city, not as a Mid-Atlantic area, not as a nation as a whole. And yes, you're spot on, Cheryl, that it was disproportionately impacting a lot of communities versus others. From my standpoint, I want to make one thing clear, because I really want to take this moment to actually sit back, and we have a lot to cover with that question, but to sit back and still be congratulated. Right now, where we're at in the hospital that I was at today, the Hopkins Bayview one, 0 cases of COVID in that hospital. Like, we still have some ways to go. Don't get our foot off the gas at the moment. But we only achieve that not because of your doctors and nurses. We've said this throughout the year. We are not your front line. We're your last line. We're your last line of defense. If you have COVID, it's a different conversation. Your front line are those who can promote health and prevent disease. Exactly what we're doing here. And the way we got here was because the community understood the science. They had a trusted relationship with certain individuals. They followed infectious control policies. And a lot of them prioritized the vaccine as well. So we got here. Where we're at here is not because of hospitals, not because of clinics, it's because of the community. So I really want to take a moment to reflect that night and day where we're at. You know, the silver lining is ahead of us, and want to take a moment to congratulate everyone. Dr. Golden, do you want to tackle the disparities conversation?
Yeah, sure. No, I'd be happy to. And you know, and just to say that I think what Dr. G said is true. And the one thing I want to sort of emphasize as we're talking through this conversation, as we're talking about prevention practices and why we should be vaccinated, is to just remind you, because I feel like we're in church, because you know, when Pastor Davis joins, I actually got married at First Baptist Church of Highland Park, is that, you know, as the scripture says, are you your brother's keeper? And the answer is yes, you are. So all the things we're going to talk about are things that really are things that you can do. It's not only protecting you and your family, but our whole community. So I just want to emphasize that. So back though to Cheryl's question about why is it that we see these disparities in our community. And I think what COVID really did uncover were how all the gaps in our community really put minoritized communities. So the Black community in particular, the Latinx community, the indigenous community, really put them in a situation where they were unfortunately at a high risk of dying from contracting and dying from COVID-19. So, you know, if we think about those things, it was things like being in an environment where you have housing instability. So many of our neighborhoods, and I practiced in Baltimore City, but this is true throughout other parts of Maryland, is that you have multiple generations living in a household. So when that happens, it's very hard to socially distance and isolate once you would become infected with COVID. There were other challenges like the types of jobs that people have. And so, you know, we thought about like frontline workers during the pandemic as being physicians and nurses and healthcare providers. But there's another set of frontline workers that I don't feel like we acknowledged enough. Those were all the people in environmental services, all the people in food services, everybody who was in public transportation, all the nursing aides going out to people's homes. So they were more exposed to COVID by nature of their job. And some of those jobs actually did not even have paid sick leave. So people were reluctant to take off or even go seek medical care because they knew if I'm off for the 14 days I have to quarantine, I'm going to lose money.
Wow.
And so these were the challenges that really made it hard, made our community more susceptible to contracting COVID-19. And all of those things, unfortunately, exist because of the systemic inequities in our country and our policies, you know, around housing and employment and all of those things that made the communities more susceptible. And so, but I think while that may sound dire, I think it's important, number one, to recognize that, but it also tells us, particularly for those of us as health professionals, that we need to not only advocate for the Black and Brown communities within the healthcare system, but outside of it as well, so that we can correct those structural issues that contribute a lot to our health. Because as Dr. G said, once you reach the hospital, we are the last line. 60 to 80% of what happens in our healthcare happens outside of the hospital. And so those were the things that put our communities at risk.
I love it. Well, Johns Hopkins Medical Center is, of course, one of our sponsors, right, tonight. So, and without it's the obvious, tell us why it's so important for you guys to reach the Black and Brown communities, or wanting to make sure that this message is out to them.
I mean, I think for me, so I will just say I grew up in Prince George's County, and but I've been in Baltimore for 27 years now, as a physician, and so that's been my community. And I think the other thing that's important to me is that I was a diabetes specialist before I took on my current role. That's another disease that affects Brown and Black communities. And so I, was looking at these things, occurring, and recognizing that what happens in diabetes is the same thing that happened in COVID. So, one of the reasons that we get sick is we lack the right information. And there is a lot of misinformation floating around right now. And so it is really important to me personally to make sure that our community has the right information. My pastor says you die for lack of knowledge, and so we want to make sure that people have the right information. And I feel like that is a part of my personal mission, in this space, and particularly in my home state of Maryland, to make sure people get that information. And get the facts and not really, and get the facts and really get the information they need to make the right informed decisions. And I'll also share personally that I think as a Black physician, there are none of us who probably have not been directly impacted by COVID. I have had close friends contract COVID, family members contract COVID. I had a very close friend that I grew up with, in the last 3 months, died from COVID unexpectedly. Hadn't quite reached the age eligibility for the vaccine. Was 1 month shy of them opening it up to all age groups. And so for me personally, watching family members cry over the loss of loved ones, that is something that happened during the pandemic that I can't unsee. And that has personally impacted me. So that's why I feel so strongly about this.
I like it. Did you want to add something, Dr. G?
Yeah, of course. And from my standpoint, my narrative of growing up in Baltimore as a son of immigrants was always my narrative. It's my family's narrative. But quickly, I discovered, growing up in Baltimore, that everyone has a different narrative of Baltimore, has a different narrative of the United States. And from my standpoint, while I may not be able to take on empathy and walk in someone's shoes, I can always stand by their shoes, right? I can always stand by them as we walk through that together. And that was emphasized to me growing up in Baltimore. Community, regardless if you're assisting the Black community, the Hispanic, Latino, or the Greek immigrant community. If you put us together for a greater good, you will accomplish that. Right. And now as a physician, that's where my calling is, right? I don't go into the communities as a physician. I go in as a human being who happens to be a physician. And especially in Baltimore, I go in as a Baltimorean, wanting to help as much as we can in order to make a bigger impact. From my standpoint, if medicine is to be a public trust, and it's broken that promise so many times, if it's meant to be a public trust, it needs to work with groups, it needs to work with individuals who have the public's trust. Only in that way can we make a bigger impact. And from my standpoint, working with the community, working with the Black community, working with Greeks and so forth, it's always about putting something bigger than us ahead of us. And that's why it's important. And I will also say, Dr. Golden is my mentor. And so she leads by example, and many of us are her disciples that go out and do this work as well. So it's important to us because for our standpoint, it's in our ethics, it's in our morals, it's in our fabric of our souls.
I love that. Thank you so much. I love how it's it's personally effective for you guys. It's a personal mission for you, not just because of your profession. So I want to talk to our pastors and faith leaders, and Anthony can jump in on this as well. But in the faith community, we started seeing people within the church community dying at alarming rates. People, not listening to the facts, but just saying that by faith, I'm just going to go out here. Pastors were still having church, still gathering the people. People were dying in their congregations. What is the message that is being shared in churches, in your churches? And what's your perspective of, I don't want to say faith over stupid, but faith over facts? Let's just talk about that.
I guess I'll jump out there first. Having had COVID and I was in isolation for 38 days.
Wow.
I think having it gives me a different level of reverence or fear or respect for it. The psychological impact of suffering alone, of being away from family, et cetera, and the respiratory impact that I'm still experiencing 8 months later, where I still have bouts with my breathing. It's a very serious thing. So I take a much more conservative approach towards regathering than maybe some, just because of my experience, not because I'm smarter. I went through it.
Mm-hmm.
And I think relaxing, there's an excitement about regathering, right? So it'll be fun to come back together, but is it safe? And that's the question I keep asking. And relaxing in certain contexts can be dangerous. It can be fatal.
Mm-hmm.
You see it in sports when teams get big leads and they relax and then they lose. Or you see it in politics. We had a governor race in this state some years ago when the Democratic candidate just relaxed. I got this. I'm okay. You relax, you can lose. And I think we're getting really relaxed around COVID. But I'm a big basketball fan. Chris Paul is out of the playoffs right now because he got COVID. So we're still in a pandemic, and I just think we have to be very careful. So that's the approach I take. I'm very cautious about anything we're doing in the name of the thrill of getting back together.
Mm-hmm.
I'm just as concerned of the risk of doing it.
Yeah, that's good. Pastor Wesley?
Well, I respect different people's theology and faith perspectives. I am grateful that within our church family, we've never seen science or technology as mutually exclusive to faith. As a matter of fact, one of the things we try to espouse within all of our workings is that faith is no excuse for foolishness or ignorance. That faith doesn't allow you to go jump off a building and say, the angels are going to catch me. It's also an embrace of science as a tool that's used in the hands of God, not something created and used by the devil. It's like any other weapon, depending on whose hands and whose heart it's used from, will determine its outcome within our congregation. So I think it was important for churches, and I think we were one as well, to model an immediate shutdown and a messaging that your safety is more important than anything. I am grateful that we did not have a COVID-related death within the family. Of course, families had some, and I grieve and pray with them. But in my former church, there was a COVID funeral that they didn't abide by the protocols. And the husband who died, the wife also contracted it and passed away, and the daughter contracted it at the funeral and subsequently passed away. And that's a narrative that we've been sharing time and again, that one life lost because, as Dr. Battle said, we relaxed, is a tarnish and a stain against the body of Christ that we don't need to bear.
Right.
I would rather keep our doors closed and keep you safe watching us online at home than to risk you getting in church and it being fatal.
Yeah.
How does that glorify the Lord? How does that espouse the faith that we say we believe in? And we all saw those stories of conservative evangelicals, faith, I'm going to be healed, I'm going to be fine. And then they're passing away.
Right.
So it was important, I think, for churches to model it. And later, Cheryl will probably get to it. I think the bigger challenge was for us dealing with why you should be vaccinated, not why we should stay closed, but why you should be vaccinated was where the real education had to come.
Absolutely. And we definitely will get into that. I want to do a whole segment on vaccinations. But Anthony, I want to ask you, from the faith community, from the entertainment community, and representing millennials and young people, because one of the things as a youth and young adult pastor I learned is that a lot of millennials shied away from, wanting to do the things that we were asking to do, the 6 feet distancing, to not gather, to not wear your mask. Like, they were invincible during this pandemic. And now we're starting to see young people getting COVID at alarming rates because of their lack. And so I want to know, from your perspective, how is that being, how are you seeing that, first off? And then how can we get the message to them about the dangers of this?
Got you. Well, first of all, excellent question. And second of all, while I'm honored to speak, I sure wish I would have went first, because Dr. Golden and Dr. G, and then Pastor Keith Battle, and Pastor Wesley all spoke so eloquently, and I am the youngest on the panel.
You're fine. You're
I
fine.
hold as best as I can. That question, Cheryl, really hits home for me because of the humongous game of operator that has transpired in our community, particularly. In other words, these Google doctors, these people who get the facts from just their friends, or just their, just who's in your ear when it comes to this COVID pandemic, has made a humongous difference in how the outcomes played out for so many people. And in our community, that game of operator has led us to believe, and especially for the younger folks, that this is an older person's disease. The first thing I heard about COVID when it first came out was that, I'm 17 and under, I can't get it. Mm-hmm. That was such a horrible way for us to approach COVID from the millennials and then the generations behind mine, because it did create this stigma that we were, invincible to it. Some of the disparities I feel like in our community definitely creates a lack of trust with the medical field, and we don't have enough voices, strong voices, that partner in our faith-based space to really create that partnership. I think Dr. G spoke about it. That partnership is quintessential, and it really has been life-saving, at least for my own church. I'm not a pastor, but I do represent my church the best I can, the First Baptist Church of Glenarden, and my pastor, Pastor John Jenkins, he as well, Pastor Wesley, took a huge stance in our community and in our church to shut the doors and really, really care about the safety and the information that our church needed to hear and have before coming back together. We still have not come back together. And like Pastor Keith Battle has said, he's extremely conservative, as we all are, with the safety and the caring of those who are in our community. So I think what's really, really important, especially for younger voices, my mother is a certified peer recovery specialist at Johns Hopkins. She works at the hospital every day. And so the conversation, and even Johns Hopkins presenting this, is so dear to me because I'm from Baltimore. My mother works at the hospital. And I realized something from my mom and her story and who she works with every single day, is that we all have a responsibility. There's something individually that you can do. There's an impact that can be made. And so many people with COVID, because we didn't know anything, chose to sit on the sidelines and wait things out, even as it pertained to quarantining. And definitely now, like Pastor Wesley said, in regards to getting the vaccination, we're kind of gauged to sit back and just see what color the wall turns first. And for me, it was important just to use the voice and the platform that I have to try to engage as many people as I could. That was my way of saying, I can't sit out of this fight. Let me get information, which I did. Talk to doctors and specialists that I trust and know. Have family conversations, not even just big platform conversations, but conversations right in your family nucleus about how we're going to handle this pandemic. For my dad, personally, I didn't see my dad for a year. Because for us, love meant I need to create that distance so that we can love beyond this moment. And love initially makes us all say, let's get close, let's hug, let's be close to each other. But this pandemic redefined what love really is. If I love you, I need to follow what these guidelines are saying. And so my dad, he has 4 sons and a girl. He was unrelenting with those of us, even in the crux of our family. It's like, you can come see me at the door. You can drive by and we can wave. Let's still find other ways to connect. Let's get on Zoom and let's do things to connect and stay close as a family. But for his safety and those who were in his household, he made that stance. And that was a big deal to me. So I think just using your voice, using the platform that you have to at least inform as many people as you can, that was a big deal for millennials and those of us who are a little younger.
I love that. I love it. All right, guys, I want to hear from our audience. So if you have questions, we want to hear from you. We have some experts on here. We have faith leaders. We have artists. We have people representing all generations, all genders, right? So we want to make sure that we're answering your hard questions. If you have some reluctant questions, I mean, no question is crazy. We want to be able to address it. Maybe you are that person that says, I believe it's a conspiracy theory. Maybe you are the one who's saying, I'm not going to get vaccinated. Maybe it's you. But we want to hear from you because we want to be able to address and answer the questions that you have. I want to start talking about the vaccine because I think people misunderstand what the vaccine does. Like, the vaccine doesn't prevent you from getting COVID, but it will keep you from dying from it, right? It will also prevent you from, from spreading at alarming rates, because the more people who get vaccinated, the more we can open up and be among people. Let's talk about the vaccine. Give us some facts, give us some things that you'd like to share, that you'd like our audience to know about the vaccine. And we'll start with you, Dr. Golden.
So I think, it's interesting. I think everybody has a vaccine journey. And I know there were particular things that were helpful for me to understand, even as, it was being developed, and around the end of October, it's like, wow, one of these might actually come to market really soon. And so I think you raised some really important points, Cheryl, that, the vaccine does, it doesn't prevent you from getting COVID, but what it does prevent is severe COVID that can lead to hospitalization and death. And so chances are, if you've been vaccinated, even if you contract COVID, it's going to be mild, likely may even be asymptomatic. So what that means is you won't have symptoms that you might have it and not know it. And if you have it and don't know it, and you are still spreading it, you won't be spreading it at the same rate as you would if you were not vaccinated. So, you heard Pastor Battle talk about having COVID, and then, and then there's the long haul of COVID even afterwards. And so, to the extent that getting vaccinated prevents you from getting a severe case of COVID that has those long-term consequences, that's a benefit. The other thing, I know one of the questions I had was, I had heard that the vaccine technology was new. This was an mRNA technology, and we can talk more about that if people have questions. And so what's interesting is that the technology itself was not new. It had been developed for about 9 to 10 years. Over time, specifically developed. So if we were ever in an infectious pandemic, like we found ourselves, that we'd be able to quickly produce a vaccine. So normally you've got to grow, parts of a virus and an egg, and it takes a much longer period of time. Because we were using this mRNA vaccine, then you could actually produce the vaccine much more quickly. So that was one of the key features that allowed it to be developed quickly. And the scientist who really was behind those most recent developments was an African-American scientist at NIH, Dr. Kizzmekia Corbett. And I have to say, as another, Black woman who is a physician scientist, I was just very excited to know that someone from our own community, who even a younger generation, had the innovation and foresight to really be able to produce something that has a great impact in the community. So, I think the other thing I will say about the vaccine is that, people say, well, I'm going to have, side effects. And so really the COVID vaccine is just like getting the flu shot. And in fact, I remember when I got my shot at work, when they were vaccinating healthcare providers, I had somebody, because I wanted them to take my picture so I could post it and encourage people to get vaccinated. And I said to the nurse, are you already done? Like, I actually couldn't feel the needle as much as I do with the flu shot. And yes, my arm ached the next day with the second shot, but it was no different than the flu shot. Or if any of you have had the shingle shot, don't feel great after that either. After my second shot, I did have chills for a little bit and some fatigue, but I was actually happy to feel that, because when you feel those side effects, that means your body is actually generating an immune response. It means your immune system is recognized this is not a part of your body and is generating a response. So then the next time you get exposed to that coronavirus, the COVID-19, then your body will say, oh, wait a second, this isn't me, and it'll be able to activate that. So, those are some of the things around side effects. And I just want to address one that I've heard a lot, and I think this is certainly still floating in our younger community, is that, there was like a chip, or there's a tracking device, associated with the vaccine.
Or medical. It's a medical.
Yeah, molecule. And I'm just going to hold up the cell phone here. So I've been telling everybody, this is the tracking device. If they really want to track us down, they can tell you where you've been in the last 24 hours, what you ate for dinner, and what you last searched on the internet. And I just say that it's a little bit of humor in there, but again, these vaccines were developed by scientists with very well done clinical trials. The reason they were able to be developed so quickly is because this technology was ready, and the government and industry put up the money so that we could develop the vaccines quickly. So what was happened quickly is that the financial investment was put up front, because Americans, people all around the globe, were just dying in huge numbers. I mean, tens of thousands a day. So that's sort of like some sort of quick facts about the vaccine. And Dr. G, I don't know if you want to add some things to that.
I'll add. Dr. G, let me bring on Dr. Henry Davis III. He's here with us now, so I want to bring him up. Hi, welcome.
Great, glad to be here. Hopefully, can you hear me?
I can. Welcome to the conversation. Glad to have you.
It's a great conversation, great leaders. You don't need me, but I'm glad to be here.
Awesome. We do, and we're glad that you're here. So, Dr. G, we wanted to hear from you as well as to what it is you want people to know about this vaccine.
I'll tell you three quick things, because Dr. Golden was spot on. First, these vaccines from Moderna, Pfizer, Johnson & Johnson, and likely Novavax that will be federally approved probably in July. These are some of the most well implemented research around diversity, meaning they took on populations that look like the populations that were being ravaged. Johnson & Johnson, by far the better one, it had close to 30% Black patients. Moderna and Pfizer both did great, where they had around 10 to 15%. And I say this because if you look at the medical literature, we're usually recruiting Black patients around 2 to 3%. So this is by far the best in regards to health diversity. The second part that I always like to emphasize is, the vaccine side effects. I tell patients, like, if I had something that made you sweat, short of breath, and your muscles will ache, would you do it? And people are like, no, I don't want to do it. I'm like, that's exercise, right? These are side effects because you rev your body up, right? When you rev your body up for the purpose of health, you will feel some side effects. They're transient, they're momentary, and they'll move on. The last thing I will say, and this is kind of a throw to my mom. My mom walks around with her smallpox vaccine proudly, because she was part of a generation that stepped up to end smallpox for the next generation. And that's what I think she's like, you guys are being called to do the same thing, to do something that no other generation's been asked to do before. You can end this and protect the future. And so from my standpoint, I always reflect on my mom's smallpox vaccine scar. And, we're being called to act in the same way, not just jump in. I agree. Like, as Dr. Golden said, get the information, prioritize this, and make the best decision for yourself. But recognize it is one meant to impact everyone.
I like it. And also wanted to say too about the vaccine is that if I'm vaccinated and you're vaccinated, the likelihood of us transferring the disease to each other is low. So that's another reason we're talking about herd immunity. You hear those words. I see your hand. Go ahead, Pastor Wesley.
So I really appreciate that. One of the things we encountered within our church, and it's strange because, Anthony, it was more your generation than older African Americans who probably were closer to the Tuskegee experiment, right? So let's be clear. There's a historic misunderstanding of how vaccines were developed after that. The protocols were put in place to be certain. And I really wish Dr. G or Dr. Golden, I guess I could pull them both, Dr. G, will explain like how the protocol for vaccination changed as a result of what we found out happened. So the conspiracy of Tuskegee, the conspiracy of Henrietta Lacks, has created this mistrust of Blacks when it comes to science and vaccination. And I think it was real critical to address that. I mean, I know we're not allowed to talk critical race theory, but I mean, if we could walk into history just a little bit.
No, good. Yeah.
I'd appreciate them being able to kind of explain a little bit about like how that changed, how that can never happen again.
Yeah, I'd be happy to address that because I think it's critical. So first, I think it is important for the medical establishment. And it's interesting because the term they'll say is the Black community doesn't trust the medical establishment. I'd like to change that narrative a bit and say the medical establishment violated the community's trust and need to earn it back. And so I think we have to acknowledge that, yes, those things happen. But as Pastor Wesley said, because of that, and I just want to clarify one thing with the Tuskegee syphilis experiment, I've encountered many people that think that the men in Tuskegee were injected with syphilis. They were not. They contracted syphilis. Treatment was withheld. Syphilis was an antibiotic that could cure it, and it was withheld so they could observe what would happen to them. And of course, awful things happen to them in the natural history. So I just want to clarify that part of that. But then after that, what Pastor Wesley is talking about is we now have two sets of things. One is in the research setting, we have a whole office, a federal office that protects human subjects in research. So all the people that were in those vaccine trials, they had to sign an informed consent form. At any point in the trial, if they got uncomfortable and wanted to stop, they could stop with no consequences. There's always medical backup. People can decide they no longer want to be treated. So these are all the protections for human subjects that are federally regulated. So that's really crucially important. The other piece is from the medical treatment side of things. You also, when you go into the hospital, you sign a consent to be treated. And before they do any procedure on you, a surgery, a colonoscopy, whatever it is, you sign a consent form. And so those are all protections put in place because it was not only the Black community that was exposed to those really terrible experiences, but it was prisoners. It was people with various intellectual and physical disabilities, people who were institutionalized, immigrants to this country who were not, white. So again, these are atrocities that can't happen. And I would add, because we have more diversity, racial and ethnic diversity in our biomedical and research workforce today, you have allies on the inside that are looking to make sure that those protections are never violated.
I like it. I like it. I really love how you broke down the Tuskegee experiment, because that is the myth that is going, around, that they injected them with syphilis and they died, but that wasn't how the trial went. So we need to know the facts as to how that went. And the atrocity was the atrocity. And so we have to make sure that in the medical community that that's not happening. And I believe that when you say that we have people and allies, in place so that we can really trust the science. We can trust the science in this with regards to the vaccine. We have a number of questions I want to be able to address the audience before we talk with our faith leaders and to Anthony again. So here's one question. Can one of the medical doctors address the misinformation that the COVID-19 vaccine technology alters your DNA?
No, I can jump in.
I don't want to chuckle because I just said no question is right.
No, but Cheryl, I will say this, if your audience feels so comfortable to ask these questions, this is important, right?
Absolutely.
If some person takes this on, they can go back.
I hadn't heard that, but that's a great question.
Yeah, no, this is a great question. So the answer is it doesn't, right? So the end result of every vaccine is to be able to give our immune system a memory, right? So this is how I put it to every student. If I gave you a pop quiz, would you pass it? Maybe. If I let you study it and gave it to you again, would you do well? Yes. That's how well our immune system works. First time around, we'll do our best, but second time around, it won't get fooled. It'll make a memory and it'll know how to precisely attack. Oh. How to get to that, there's a variety of technologies, right? And so the one that comes up often is Dr. Golden mentioned earlier, we have the mRNA, right, vaccine, which is an amazing technology. It is the Tesla of vaccines, right? We've come a long way from cutting people's arms and pouring pus into it to prevent them from getting smallpox in the early 19th century. It does not alter your DNA. That mRNA gets into one of our cells and uses the machinery to make the protein, the spike protein. After that, it goes away. The mRNA disintegrates. It's done. It's literally in your body for a few minutes at the most. The proteins in that impact, that lasts for at least for the foreseeable future, because we've studied it for about 6+ months. So no, it does not alter your DNA. It gets us the end result of the immunity and therefore protecting ourselves and, Cheryl, as you said, everyone else.
I like it. All right, let's go to another question. Pertaining to the vaccine, is there any word on whether we will have to get booster shots? I'm hearing that too, that after, the vaccines aren't going to last, and so we're going to end up having to get booster shots. Can any one of you address that?
I think that the jury is still out in the sense that this is June 22nd. And so it was about this time last year, believe it or not, that the first vaccine trial participants enrolled. So we're just getting to the point where we're going to have the 1-year follow-up data on those who were the first into those clinical trials. So what they're doing is they're continuing to follow all those individuals who were in the trials, because they can look and see, okay, how long is that antibody response staying adequate, and when might they begin to see that the antibody response, has declined. So I am expecting that sometimes in the next few months that we might actually have a little more information. We know that we at least can go 6 months, but that's because that's all the data that we recently had. Now we'll be to the point where we'll almost have 1-year data. So that will give us a sense of if we're going to need a booster, at what time frame would that need to happen. And there are already some booster trials and studies that are being conducted in the field.
Got it. All right, we have another question. I want to go to our faith leaders in just a few moments. Please address the disparity in availability of vaccine and healthcare pre and post COVID-19 between the African American and other groups in Maryland. I don't know if there is a disparity in availability for vaccines right now. I know there was initially, but I believe now you don't even have to make an appointment. You can walk into certain places to get them. Do you guys want to address that?
Yeah, I think that's probably where we have come the longest way since January. I remember in January, my parents are 85 and I was signing them up everywhere, and there were no phone calls. It was really very challenging. But I would say probably since maybe about April, then now there's multiple ways you can walk into a Giant or CVS pharmacy and get a vaccine. I think that's completely amazing because, we couldn't do that initially. And then through public health departments throughout the state of Maryland, they're partnering with a lot of community organizations and churches. I know at Johns Hopkins Medicine, we've been partnering with many of our senior housing complexes and churches, in the city, so that you can actually even have mobile vaccine pop-up clinics. So I think that we have at least removed the access barriers, which is great.
Sure. If I could, I would love to speak on that with Dr. Golden. I said, because my church was one of the churches that partnered. We actually partnered with the University of Maryland, the Capital Region in our area. But one of the things that we tried to do, because of that, at least the thought that there was disparity there in terms of the vaccine being available, is create that partnership between the faith-based community and the medical field to make those vaccines available in places where sometimes maybe it wasn't the first choice or first option, and also to educate our people. So we did series for several weeks. Pastor Jenkins did series on Bible study and our Bible study space with doctors and with people who are informed about COVID. And then we opened up our Family Life Center as a clinic and allowed not just our members, but the community to be there to get the vaccine. We were servicing 700 to 1,000 people initially, and then above that, beyond it. And the clinic just shut down last week just because at that point we only had, trickles of people coming in. But I want to applaud Dr. Golden, what you said, and also applaud my pastor in our church, the First Baptist Church, for kind of being front runners in that regard in our community, so that we could make sure that vaccine was available to everybody in our community who needed and wanted to get it.
And I love how the faith community stepped up in that regard. I know Pastor Howard John Wesley has to leave for another meeting in a few, but I really want to give you opportunity to talk about the vaccine, the importance of it, and what you guys did at Alfred Street with regards to vaccines and COVID-19, so that people will know what the faith community. And I'll give our other pastors an opportunity to talk about that as well.
Yeah, well, thank you all, and I apologize for having to run. And we actually have a meeting around our reopening plan about how we're going to start to safely bring people back in, and registration and vaccinations and social distancing in place, what the new protocols are going to be, removing the live offerings so there's no contact, all those pieces that are just necessary, sanitizing restrooms in between use, to make certain that the church is safe. And I think, Anthony, one of the reasons like our churches were able to attract so many is because the Black church is still a trusted institution in Black communities. And so when First Baptist opens, there may have been someone who saw it and was like, I ain't going to CVS, but you know what? If First Baptist is doing it and Pastor Jenkins is behind it, okay, I'm going to trust it a little bit more. And that happened with all of our churches. It happened at Alfred Street. We partnered with Community Health Center, it became a site, and we saw a large influx, especially of our own members who were saying, okay, if the church is doing it, it must be safe. And it's very critical for us to get back to that place. I don't think we'll ever be back where we were in these mass gatherings where we just open the doors and we're sitting two on top of each other in a pew. I think the world has changed dramatically, and how we figure that out with church, I think it's going to be unique to each church and its population, its congregation. But we're looking to develop those plans of slowly re-entering, registering, so we know that we've capped out at as many people as we believe are safe to be in the building, as opposed to coming in and knowing the usher who says, all right, come on, I'm gonna find you one more seat. We're gonna squeeze one more person in. Because again, one outbreak and one member dying because they were in our sanctuary is way too many for us.
Right.
So we're going to continue to err on the side of safety. Vaccines are out. The world is opening, but Dr. G, we still want to be safe. We want to be certain that people know that, and maybe one of the doctors can answer this before I leave. Someone has basically said that COVID's never going to go away. It's going to be like the flu from here on out, that this is just something that will always exist. And we always, Dr. Battle, have to keep our guard up. And so I'd love to hear an answer about that, because as we go forward, we're not going to act as if COVID is gone. And now that a handful of people are vaccinated, everyone's safe forever.
I'll answer that quickly, Pastor Wesley. And thank you so much for posing that question. The answer is it's actually in our control. If this is as good as we get with the vaccination, this is going to become kind of an annual thing that we'll have to be concerned about, right? So this is where, I really encourage the community to recognize you got the vaccine. That's amazing. Now talk to your family, talk to your friends, talk to those who are still hesitant, and direct them to where the information can be, so we can actually make COVID a thing of the past. Otherwise, we're just allowing this thing to continue making new variants. One of these variants is going to impact children. One of these variants is going to, undo the vaccines, and we have to start all over from square one. This is in our control, and we have the ability to end this. So, that's why I praise especially the faith community. I mean, you guys step up all the time, for a variety of reasons to help human beings, and you continue stepping up. I love this. So, Pastor Wesley, to answer your question, it's in our control.
That's good. That's good. So I know you're going to have to chime off in just a few moments, but I want to ask our other pastors the same question that I asked Pastor Wesley with regards to the COVID-19 vaccine. What is it that you're sharing, with your congregation? And he touched on preparation. So I want to hear some ideas on how you're preparing. Before we go to you guys, though, I do have another question that's kind of piggying off of what Pastor Wesley was saying. So let's go to that question. Okay, Dr. G, would you address the relevance of the mutation rate difference between COVID-19 and the influenza virus as it relates to infection probability and vaccine effectiveness? COVID-19 mutating approximately 50% less than influenza. In other words, the more we do to prevent the mutation, the less better.
Excellent. So whoever that audience member is, I'm hoping they're going to be pursuing a scientific, if not a medical career. This is amazing. Great question.
Might already be in the medical community, but right. I love the question. So go ahead.
So a couple of things just to kind of make sure it's one part of what everyone grasps. What a geneticist, a virologist will say is a mutation we will call children, right? Our children are technically mutations of us. There are a little bit of differences genetically, but they're still human beings, right? It hasn't deviated to a different species. Coronavirus, so viruses mutate all the time, right? So every time it comes in me, when it leaves, it is going to be a little bit different. So that tends to happen. The rate of the mutations around vaccine impact, a lot of it just depends on the simplicity or the non-simplicity of the vaccine of the virus to begin with. This one, for instance, has a single strand of genetic material. Well, it's hard to kind of change that pretty drastically compared to the flu that has that genetic material chopped up. That means there's just more chances for it to continue mutating, right? Because there's individual strains everywhere. Coronavirus is just one strain. That's why this mutates it mutates every time, but slow in a sense of something so deviant that's going to concern us. So this is where it goes back to Pastor Wesley's comment. You guys want to stop mutations? Vaccination. It's the answer, right? We have that control. Every new variant that comes out, I say this lovingly, it is kind of a failure on our end, right? We can stop that. So mutations happen more frequently in the flu to something more novel versus the coronavirus that mutates, but nothing horrible, just because of that single strand of genetic material. So it's slower mutation for novelty, and mutations are just offspring.
Got it. So let's go to our pastors. I'd like to hear from Pastor Henry Davis, since he's just joined us, of course, your take on the COVID-19 vaccine. And what's the message that you're giving to your congregation? Dr. Wesley talked about, preparing to go back into the sanctuary, and you guys could talk about some of the ways that you guys are moving towards opening back up, and, Pastor Battle said no time soon, but I know that there's going to be a plan in place. So.
Well, to be quite honest, Cheryl, we've never closed, and we have been through the vaccine. We went down to the lower numbers, but we have all done what Pastor Wesley is getting ready to try to start doing. We've already been doing. We told people to get the vaccine. We told people that when they come to church, they're going to wear a mask. They're going to be social distance. I can say to you that most people would rather watch online, but the option has been there, and part of the reason we did not want to get out of routine, and so we did not shift to recording. We ran live services. We still do 4 services live every week. Persons are in the building, and now we don't have big numbers anymore, but persons are still coming. And then, of course, by it being a vaccination site, we've had persons to get the vaccine, then say, I might as well come to church. And they come to the grounds to get the vaccination. And they say, well, if I'm safe enough to come to the grounds to get the vaccination, I'm safe enough to come to worship. And so we've had wonderful time. We've blessed babies. We've baptized. We've done the things that many of the things that we did prior to, but again, there have been some adjustments. We have not done any funerals because again, that it opens up a whole nother Pandora's box of persons. And the reason why we stopped doing funerals is basically persons wanting us to do what Pastor Wesley said, to break the rules. Can you get 1 more in? You can get 5 more in. And we didn't want to go through that exercise, and so we pulled back from it. But it's been a journey, and as I think all of us would see when we get more and more persons coming back, it's going to be a different dynamics. We don't have big choirs anymore, and we have social distancing. But I'll give this one to Pastor Battle and Anthony Brown and Pastor Wesley. Our biggest crowd, 120. That's the biggest amount of persons we've had to come to worship. And so most people have opted on the option of online. And as my colleague Maurice Watson says, church now is online with an in-person option.
That's good. Pastor Bat, now there is a question, and I think we addressed some of this. I don't know if you see it, Dwayne, on Facebook from Akira Hazer, if you can show that one, because it talks about what we shared about the faith against science kind of situation. And I want to address it again because I don't think they were on when we talked about it. They said a vaccine FDA approved. Number one, and we touched a little bit about that, and I know they did a rush variant of approving it, but at this point, I believe that they have moved to FDA approval. We'll let the experts tell us that. From a spiritual perspective, we teach, preach, boast, and shout about how supernatural God is and how he is a healer and protector. Is it foolish for believers to trust God to keep them and protect them from the virus and or deliver them if they get it without the vaccine? So he said this is his wife's account. So it's the husband that asked the question. So yeah, we addressed that earlier, but he put it there a little differently. So Pastor Battle, Anthony, Pastor Davis, any one of you guys can tackle that. And of course, let's first ask the experts about the FDA approval of vaccines. Dr. G.
Yeah. So you're spot on. To get FDA approval, you need 6 months worth of data. That's what Dr. Golden was emphasizing. Given that we were in a pandemic, the company submitted it at 3-month mark, which allows it for emergency use. That's what we cleared it for. So the companies just followed the guidelines of 3-month worth of data gets you emergency approval. 6 months you submit it for a full FDA approval. So I see this because that language gets manipulated when people are like, well, the vaccines aren't even FDA approved. No, they're approved for emergency use, yes, by the FDA. So just an FYI, it's a good question.
Yeah. All right.
And I think it's important. One thing I'll add is that no processes in that approval were skipped. Everything still went through the usual processes from a regulatory standpoint. So I think that's really, really critical to understand as well.
Right. And you can go to fda.gov to get the understanding of the processes, right? So you can understand what process they went through and what process they're in now. But let's talk about the faith issue, because I know a number of people are asking this question. So that's why I wanted to address it again. So any one of our faith leaders can share.
I'd like to respond to that. First, to Pastor Davis' statement, it was 120 people on the day of Pentecost that changed the game. So that's all you need, bruh. That changed the game. To the listener who said, is it a lack of faith to not just trust God to keep them and protect them from the virus without the vaccination and deliver them if they get it without the vaccination? I think I do think there is a space where your faith can become presumptuous and reckless. For example, they put seatbelts in a car. Well, you can say, well, I don't need a seatbelt. Jesus is my seatbelt. The Holy Spirit, angels are encamped around me. In fact, since I don't need a seatbelt, I don't really need car insurance, because you only need insurance if you're going to have an accident. But I'm not going to have an accident because I'm covered in the blood of Jesus and the angels guide me. And if somebody's drunk, God will keep them out of my way. In fact, I don't really need to lock my doors in my house because God knows where my house is and I don't need to lock my house up. I mean, you can get really reckless and foolish when it comes to trusting God when there are systems in place to protect us. And the vaccination is a protection. And I think when it's available to you and you don't use it, I don't think you're trusting God. I think you're tempting him.
Ooh.
Wow, that was so good.
Was that good?
Preach, Pastor Battle.
Was that good?
Instead of preach, Pastor Jenkins, I'm going to say preach, Pastor Battle.
That's my answer, with all due respect to whoever that is.
And it was great.
Akira's, Hazer's account.
But and Cheryl, I would also piggyback to what Pastor Battle says. We have seen so many. If you go back to the early stages of the pandemic, there was persons who spouted that very philosophy. Many of them had their own funerals, and many of us have been able to be up close to enough persons who have caught the virus, passed away because of the virus. And so I think that it would be extremely reckless to just say, and I think Pastor Battle really has nailed it with how he has shared today. But I think that we can have faith and science. Faith and science can work together. And faith and science does work together. And so I don't think it's any lack of faith because I take an aspirin or if I take a Tylenol. I don't think that's a question against my faith. And so I think that we need to be knowledgeable. I mean, our systems might be different, but I don't think that we can just be push it all to the side when we see that statistics and science has said that this becomes a helpful tool. And so just as the flu vaccination or anything else, I think we have to take we have to utilize the things available to us.
I love that.
Could I jump in? This doesn't need
Yes,
much.
please. Yes, please.
This doesn't need much piggybacking because Pastor Keith Battle literally dropped the mic on all of us.
Did he not?
Which he tends to do quite often.
It's so practical, right? It's so great. Go ahead, Andy.
I'm so grateful that he said what he said and to have his doctors here because I was told years ago by somebody very wise who I trust that doctors and medicine is an extension of God's healing hand.
Mm.
When they told me, I was a teenager when I first heard that, and I thought about it for many years that that the technology and the Dr. Golden spoke about the doctor who kind of was the kind of front runner with creating what is the vaccine. That wisdom, that creativity, that is God inspired. And I do believe that doctors are an extension of God's healing hand. The thing about faith that we as Christians and believers, and sometimes we are unwise, like Dr. Battle said, and how we perceive faith is that it has a partner, and the partner is works. Ooh. And without the partner, not only is your faith dead, but in this case, you could be. That's the one thing. We can't separate faith and works. They go together. And so I remember when the vaccine came up for myself, I got vaccinated in January. It was very early on when the vaccine became available that I got vaccinated. And I did it because of my status in the community. I also did it because I did the research. I did have the conversations I needed to have with my doctor and other doctors. But I said to myself, this is so silly that people talk about the speed at which this was created. I understand the caution. I had caution as well. I had issues myself that I grappled with, but I thought about it. I talked to my dad and my mom. I'm like, when I went to school as an elementary school kid, I had no idea whatsoever what the basis was behind chickenpox and measles, mumps, and rubella, and all the different shots that we have to get just to go to school. But then again, in order to go to school, we had to get them, and we got them, and we move on. I said, so the fact that everybody has to have all of the details, you still don't know what's in the aspirin, and you pop one every time you have a headache. And so there's just that combination. You do the work of taking the aspirin because you want something, and you also pray about the headache because you trust God to heal, but the two have to work together. Mm-hmm. The faith without the works cannot work together. It will be dead, and so could you if you do the both together. So for us as faith-based people, that's what we're trying to preach and push, is that it's important for you to trust God and to do the things that we learn about when it comes to faith, but also do the work. And the work for us is the social distancing. It is wearing the mask. It is leaning to what the science is saying. And in our case, it is getting vaccinated. I think that's important.
I love it. I'm going to let Dr. Golden share. We're at 7:00, and I know we're going to go a little over, and that's okay because I love the information that's being shared, but I do want to give her opportunity to address this question as well.
Well, I first just want to thank the three of you for the statements that you made about faith and science working together. So I've wanted to be a doctor since I was 10 years old, and I grew up in the church. And, and one of the things that, I was a biology major at the University of Maryland. And, you might think, well, you're going into like the scientific field and, there's all theories about all kinds of things and the like. And, how would my Christian faith sort of measure up in that setting? And the thing that happened is the more I studied science, the more it reaffirmed my faith. I was like, golly, God could be so creative. And like these molecules all fit together and, and people can like have the knowledge to understand how you develop the vaccine and how you could actually sequence that whole spike protein on the coronavirus and get the mRNA to match. And like, boom, here we are. And like a year ago, I didn't even think that I would see my son's college graduation in person. And we just did. Like that would not have been possible 1 year ago. And so I say that to say that faith and science definitely work together, just like I mentioned earlier, that there are allies on the inside. You know, there are Christian allies, there are allies of various faiths that are a part of the medical and scientific community. And so I think it's just really important. You know, my pastor at First Baptist of at Clearview Baptist Church in Woodlawn says, you know, he's like, God is going to take care of that. But he also told you to take your medicine, right? And so I really think, and I will also remind those of you who are Bible scholars that Luke was a physician. Mm-hmm. So in the gospel, Luke was a physician. He ministered to, you know, many, and he wrote one of the most detailed accounts in the gospel. So, you know, just, you know, putting that in perspective, I think is very, very important that science, medicine, and faith are not disconnected from each other.
Awesome. I love that. So we're going to wrap up. I really appreciate all of those who took time out to take a view of this information, COVID-19 and reopening the Black community. Thank you, Mr. Bratcher, for everybody who's saying that this was so good and so great and so informative. Thank you, Leah Clark. She said, all y'all talking good. Leah Clark Leach, thank you so much. Appreciate all of you guys who's joined us. Thank you for sharing it on your page, and you can still do that. And if you missed any of this entire forum, you can go back to praisedc.com, praisebaltimore.com. You can check it out there. You can check it out on both of our Facebook pages at Praise 104.1 and Praise 106.1, and our YouTube pages at Radio 1 DC and Radio 1 Baltimore. You'll be able to go back and check out the full forum, get all of the information you need. I am so honored to have Dr. Golden, Dr. G from Johns Hopkins Medicine, who came to give us all of the facts, and for our faith leaders, to Pastor Howard John Wesley, who had to leave us early, Dr. Henry P. Davis III, Pastor Keith Battle, to my brother Anthony Brown. I appreciate your input and for everything that you've added to this forum. It was amazing, and I'm honored. I think we need to do it again, but I pray that we were able to get the message out. Dr. Golden, I will give you opportunity to close out. If it's something that we didn't touch on that you want to say before we get out of here, I want to give you that opportunity.
Yeah, first of all, I think this has been a really important discussion. And, you know, I think what I would say is just remember that you are your brother's keeper, right? And so, again, when you get your vaccination, you're not just protecting your community, but you're also protecting the community around you. And I think the other point I would make is that right now, what we're seeing in the hospital are young people, young adults, and middle-aged individuals my age who are not vaccinated, who are getting COVID. Those are the people that are getting sick and dying. Those people are our future. They are the future of our country. Yeah. We do not want to lose those critical individuals, right? And so we really got to make sure that we get them vaccinated. If you have not been vaccinated, you still need to be exercising the same precautions. And I'm gonna channel on my colleague, Dr. G, and just say that he said it earlier, but remember, the hospital, by the time you get to us, we're your last line of defense. Mm-hmm. You really want to be on the prevention side. So I know everybody is concerned about the trust issues in the medical establishment, but here is the reality. If you get COVID and you get very sick and you can't breathe, guess where you're going? Right to that hospital that you said you don't trust, where you're going to have much less control over what happens to you. So if you get the vaccine, you're going to be on the prevention side of that, where you have control over what happens to you and your family and your community. So I think that is a really critical message. You have the power to control what happens to you and the rest of our community.
This has been great. Thank you so much. Thank you for a wealth of information. I saw Dr. G saying in our private chat, let's stay connected. I believe that's the truth with the faith community, and to all of the doctors. And thank you guys for being available to share this information. That's going to do it for us tonight. Please make sure you tune into both radio stations, for I'm on both of them. Praise 104.1 and Praise 106.1. We really would love to have you. God bless you and good night.